Hi, everybody. Thanks so much. Thank you, Amy, and the team at Healthcare for All for organizing this important event. Aya, who is my policy director, and I, bureau director at Healthcare Safety and Quality at DPH, really appreciate your focused attention on this issue. It is critically important. Thank you, Dahlia, for that heartbreaking but powerful story that reminds us all of why this work is so important. And it's great to hear from the legislative healthcare leadership as well. So we have some slides. Maybe we could just flip on. And let's see how the wall works. So what we wanted to do was talk about two reports. I'm going to speak about serious reportable events, and Aya is going to present our more recent report around healthcare-associated infections. And basically what we are doing with this reporting is pulling together the information that we have, that we spent, I will tell you, a fair amount of time validating data on, because when you do this sort of public reporting, it's very, very important that what you communicate is the truth. And there's a lot of devil in the details sort of work that goes into these kinds of public reports. And suffice it to say that there's it's the two of us here, but there is a team of whom we have a couple of folks. Nancy Murphy is here, if you just raise your hand, and Kara Murray. And then there's a handful of other folks back at the ranch at the Department of Public Health that spent an enormous amount of time and energy making sure that what we tell you is accurate. So if we could just push ahead to the next slide. On serious reportable events, next one please. I usually don't read slides to folks, especially such smart, well-educated folks as yourselves, but this one is critically important. This is the philosophy that we use behind reporting, and as you saw from the first slide, the goal is to incent quality improvement and to ensure transparency. Because as a consumer-focused organization like Healthcare for All will tell you, those are the two critical things that are important to the public about this type of reporting. So the goals here are to catalyze hospital-specific as well as statewide initiatives to address the most preventable infections through surveillance and dissemination of best practices, and I would say also adverse events as well. To validate the extensive work conducted across the health system, and that work often reduces the rate of preventable adverse health events. So in other words, we're going to tell you when things didn't go well, but we also want to tell you the great work that is making things go better and better. That is a very important message as well. And the purpose is to inform sort of three broad constituencies, which is the consumers, the patients, the family members, the general consumers of healthcare, the policymakers, many of you are in that group, and as well as the actual folks at the healthcare facilities that are managing this on a day-to-day basis. So it's not easy to communicate to three broad constituencies like that in the same using the same methodology, and we really worked hard to try to improve our ability to do so. And we would welcome feedback on how we're doing in that regard. And it really to use the lens of SREs and healthcare-associated infections as an indicator of a broad focus on quality and safety in healthcare organizations, because they are very, very good markers in ways that we'll show you, that there is a team of providers and others at the healthcare facility that care about this deeply and that think all the time about stories like the one that we just heard, because that's the power. Thanks, Julian. So we'll skip over the slide, but suffice to say we have the authority to do this sort of public reporting. I hope you trust us, but in case you don't, you can look it up. National Quality Forum definitions, very important to know. I just presented on this to some PhD students yesterday at Brandeis, and one of the important questions that came out of that presentation was, tell us about the case definitions. And you know, that's very, very important. In the provider world, if you don't compare apples to apples, it's really not fair. On the other hand, there's an awful lot of apples to look at. So the NQF provides a national standard in 6 categories of definitions of what the potential serious reportable events are. And as is good practice, they constantly relook at that. So the data that we're presenting now is based on the definitions that were true at the time. It has been revised, and we're going to be revising our work based on that, probably by this summer. But the broad categories are surgical events, product or device events, patient protection events, care management, environmental, and criminal. And the short story is that in acute care hospitals in 2010, we're presenting both 2010 and the first half of 2011 data. In the Commonwealth, there were 369 serious reportable events in those 6 categories. In 2010 in acute care hospitals, 53% of those events were environmental, and almost all of those environmental events were falls. All the 6 categories were, however, represented, so there's work to do in all areas, but falls is a huge problem. Next slide, please. And then it was a sort of similar information that came out from the first half of 2011. There were 159 SREs. There were none in the realm of patient protection or product device events, but again, 57% were environmental, and almost all of those were falls. So falls is a very, very serious issue in acute hospitals. In non-acute hospitals, similar picture. In 2010, there were 143 SREs that were reported. More than half of those were environmental, and almost all of those were falls. There were no surgical or product device related events, which makes sense in a non-acute hospital. And the data is pretty similar for the first half of 2011. 58 SREs, 67% environmental, all of them were falls. And again, because of the nature of the services provided in a non-acute hospital, there were not some categories such as surgical and product device were not found. So we can see that if you were going to sort of put your money where your mouth was and you were going to try to do something around SREs, going for improvement in the rate of falls would be a very profitable endeavor, very likely. And the truth is, there's a lot of good work in this realm that hospitals are doing. Can we have the next slide? We do look at this data, we try to drill down in different categories, and one of the ones that we do look at is whether or not health disparities seems to play any role, and that we found in these data from a year and a half that did not seem to be the case. We have a little bit of improvement that we'd like to see in actually making sure that every reported case does accurately reflect race and ethnicity, but the truth is, for looking at this broadly, it does not seem that that's an issue. I'll go to the next slide. So the sort of long story short is that SREs in Massachusetts over the course of the last 3 years, and this new data is from 2010 and 2011. Here we're projecting if the rest of the 2011 goes the way the first half went. We're looking at graphs that are largely improving in terms of the efforts that are being made to prevent serious reportable events. What we did with this report is we drilled down in 2 very highly represented areas, falls and pressure ulcers, both because they're common SREs and because, as I said at the beginning of this, data validation is incredibly, incredibly important. When we get reports on a serious reportable event, we're getting essentially a story. And once again, it's really important to be comparing apples to apples and make sure we know exactly what we're talking about. So the labor-intensive nature of making sure that we've got the details right is very significant. It's also very important to remember that reporting is getting better and better. It's a skill like any other skill, and the more you do it, the more you practice it, the better you get at it. So doing things like root cause analysis type of work is something that when you do more of it, you do it better. And we're finding that the reporting is improving, although there's a long way to go in that regard. So we'll go to the next slide. Oh, excuse me. We'll just back up for 1 second. I apologize. So this is the slide that shows falls with death or disability, which, as I mentioned, is the most common SRE. It's declining by the data. And then stage 3 and 4 pressure ulcers, which are the most extreme wounds that one can get from a pressure. from pressure on the skin. We had a bump up in 2010, but it is improving as 2011 is projected. And so that's really good news. When we looked at the issue of whether or not the public nature of this information influenced the reporting of the information, we were pleased to see that it's a little hard to read this slide, but our data is represented by the circle on the right. That's 369 events in 2010, and that's public information. When the hospitals report that, they know that it's public information. The Board of Registration in Medicine also mandates the reporting of these serious reportable events, and that's different circumstances around that reporting, and it's protected. And you might say, well, if people are very afraid to report, those numbers would look dramatically different. And the truth is, the number in the half of the circle that's light blue, that's to the right, which is 393, is the analogous data that's protected at the Board of Registration. So 393 versus 369, not a huge difference in terms of the numbers, and that helps us to understand that the reporting that we get is probably pretty accurate. We'll go to the next slide. So here's an area where we had some concerns. With falls and pressure ulcers, we had spent 3 years and 1 year doing significant work around data validation, and we felt that the definitions were accurate, that the hospitals and the Department of Public Health both were talking about the same things in the same way. With medication errors, we looked at the data, and we were frankly deeply concerned. In 2008 and 2009, there were respectively 12 and 7 reported medication errors as serious reportable events in acute care hospitals in Massachusetts. Already, I have to tell you, as a physician, a little concerned about that data. In 2010, there were 9, and in the beginning, first half of 2011, there were none reported. Now I'm really concerned, okay? So what we decided was, rather than reporting this data out as, oh, look what is happening, we made the decision to go back and do some data validation work in that realm, just as we had done previously in the areas of falls and pressure ulcers. And so we're not reporting this as numbers that you should pay attention to in terms of medication errors. What we're saying is there's work to be done in this area, significant work to be done. So that's serious reportable events, and now I'm going to turn it over to Aya to talk about healthcare-associated infections.